This segment is sponsored by GBMC Healthcare.
All right, there's been a lot of talk about monkeypox, but what exactly is it? Joining us to answer this question is the infection control practitioner at GBMC, Molly Hyde. Hey, Molly, welcome to the show.
Hi, thank you.
All right, so what is monkeypox exactly?
Yeah, so monkeypox, it's a viral infection that can infect both animals and people. And this virus is in the same family as smallpox, but it tends to cause less severe disease. And despite what you may be thinking, this isn't actually a new virus. We've known about it since actually the 1950s, and it is endemic in several countries in Africa.
Okay, now I know there's still a lot of questions surrounding it, but can you tell us what caused the latest outbreak?
Yeah, so unfortunately, I can't tell you that because we don't actually know what caused the latest outbreak. So typically, outbreaks that are seen outside of Africa can be tied back to an endemic country, either travel to that country or contact with animals that are imported from that country. This is the first time we're seeing spread outside of endemic countries that can't be linked back. So we don't know exactly what the cause of this outbreak is, but public health officials are still currently investigating that.
Okay, now can you tell us what some of the symptoms are and how it's treated?
Yes, absolutely. So it typically starts with a fever. You may have other non-specific symptoms like headache, fatigue, muscle ache, swollen lymph nodes. And then usually about 1 to 3 days after the fever starts is when you develop a rash. Now, this rash is very distinct. It's circular lesions that look like little blisters all over your skin. It oftentimes will start on your face and then spread to other areas of your body, but it can start elsewhere and it may not spread. So you only may have a few lesions if your case is not that severe. In terms of treatments, we don't have any specific treatment for monkeypox. Fortunately, most cases do resolve on their own without any intervention needed. People who have more severe symptoms can go to the hospital for supportive care, and there are some antiviral medications for smallpox that will likely be beneficial in treating people who do have monkeypox.
All right, now, how many monkeypox cases are there typically in the U.S. or the world?
So not a lot. Even in endemic countries, human cases of monkeypox are pretty rare. They're oftentimes associated with contact with animals, but human-to-human transmission can occur, as we are seeing in this outbreak, but it typically requires direct physical contact, so actually touching somebody who is infected and having contact with their lesions or body fluids. It can also be spread by very, very close face-to-face contact, but most outbreaks are relatively small and self-limiting just because it doesn't spread all that efficiently.
All right. Now, can you tell us where we can go for more information about it?
Yes, absolutely. You can go to the CDC website. They have a lot of information about monkeypox, as well as the World Health Organization has a lot of information about monkeypox in general, as well as this current outbreak.
All right. Well, thank you so much for sharing that information with us today.
Thank you.
All right.